Welcome to the Comprehensive Error Rate Testing, or CERT program, the Basics webinar. I'm Mary Mucko with Provider Outreach and Education, and I will be your presenter today. I'm being joined by Bailey Lawson, my friend and colleague, who will help with technical problems and any questions that you place into the chat. So she'll be working behind the scenes mostly. Finally, before we start, remember to review disclaimers. They are at the end of the presentation. The notes view of the slide deck actually provides details that you need to be aware of. Today, my goal is to help you learn a basic understanding of the Comprehensive Error Rate Testing, or CERT program. I'll share some background, explain how the process works, and provide you with a number of WPS and CMS CERT resources. I do want to encourage you to add questions and comments in the chat as we go. I will answer them after my prepared remarks. So let's get started with a little bit of background about the CERT program. This slide provides details about the history for improper payment measurement of Medicare claims. The task fell to the Office of Inspector General, we call it OIG, from 1996 to 2002. They sampled only a small number of claims. OIG asked the contractors listed on this slide, and including carriers and fiscal intermediaries, to perform a review of coverage, coding, and payments for all sample claims. Now, it was the individual contractors that actually reviewed their own claims. I think it's fair to say that that was not exactly an ideal situation. When completed, OIG calculated a single national claims payment error rate based on the errors assessed by the contractors. A few years later, in 2012, Congress passed a law that required the heads of federal agencies to annually review programs that they administer to improve efforts to reduce and recover improper payments. That law, known as the Improper Payments Elimination and Recovery Improvement Act of 2012, referred to in short as IPERIA, actually amended the previous Improper Payments Information Act of 2002. This slide shows the types of improper payments, along with some examples that are used by CMS to calculate improper payments in the Medicare program. Now, incorrect payments can take form of an overpayment, of course. That's probably the one we usually connect to when we think of incorrect payment. But incorrect payments can also mean underpayments, where the provider was not paid correctly or wasn't paid enough for the service he or she billed for. Now, some examples of CMS identified improper payments are listed here on this slide. There are payments that are sent to an ineligible provider for an ineligible service. Perhaps it was a duplicate payment. That would be an improper payment. If the services weren't received at all, that means an improper payment was made if the contractor made payment on that claim. And also, if the contractor sent reimbursement in the wrong amount, it's also considered an improper payment. Now, requirements in the IPERIA law do not pertain only to CMS, but also to other federal programs that may be susceptible is what I'm trying to say there, to significant improper payments. So every year, these federal agencies are required to estimate the improper payments amount, submit estimates to Congress. They also report publicly the estimates and what the agency is doing to reduce those improper payments. So very, very transparent. This slide expands a bit on that transition when OIG was no longer responsible for that improper payment measurement. Now, CMS actually assumed this responsibility in 2002, but that transition from OIG to CMS started back in 2001, at which time CMS followed recommendations from the OIG. Now, one of the recommendations made and followed was to increase the sample size to 50,000 claims per year. That transition from OIG to CMS actually allowed for computing not just a single national claims paid error rate, but also multiple improper payment rates by contractor, by service, or by provider type. So all kinds of different payment error rates. Just last year in 2024, the CERT review sample size actually decreased from those 50,000 claims per year to 37,500 claims annually. So quite a significant decrease in the amount of claims that the CERT contractor is reviewing on behalf of CMS. Now this slide lists some of the ways that CMS uses the CERT findings. Now this includes actions that the Medicare Administrative Contractors, or MACs, must take to help reach that CMS goal for decreasing the improper payment rate. Now, you can read through these on your own time, but I will highlight just a couple. We use CERT findings to analyze errors and make adjustments to claims. So in other words, if the CERT contractor finds an error, we need to recoup any overpayments or reimburse underpayments. And sometimes we need to do this across the universe of claims, not just to the claim that was reviewed by the CERT contractor, but as a result of those CERT findings, we may initiate additional medical review of claims. We also use those same CERT findings to determine what we need to educate our providers about. We want to share those best practices with the provider community in order to avoid those CERT errors on future reviewed claims. Next in this presentation today, this overview of the CERT program, or basic information about the CERT program, and I want to talk about a little bit about the CERT contractors. The CERT reviews are not done by the Medicare Administrative Contractors. There are two specialty contractors or special contractors that CMS uses. There is the CERT review contractor. Sometimes we call this the CERT RC. Sometimes you'll hear us say the RC. There's also the CERT statistical contractor, or what we call the SC. Let's take a closer look at these. This slide actually lists the responsibilities of the CERT review contractor. They sample all the claims, they send the requests for medical records, they receive them, they also do quality control and log them in. They'll do the review of those medical records, and they are the ones that are going to provide that customer service and education support. They're going to review those medical records, as I mentioned, and then they're going to actually compile the data. Here's a couple more tasks that are responsibility of the CERT review contractor. That is to maintain websites about the CERT program. There's 3 different websites, or 3 different functionalities, rather. There's actually the CERT provider website that's called C3 Hub, and there's also a CERT claim status website that's used by the Medicare Administrative Contractors to communicate with the CERT contractor about the review of claims. And then there is the CERT management website, and this is the one that is used by CMS to share information back and forth between them and the CERT contractor. Now, I mentioned there are 2 CERT contractors. There's the review contractor, and there is the CERT statistical contractor. This slide lists the tasks of the CERT statistical contractor. They are different than those of the CERT review contractor. Now, the SC designs that sampling strategy. They calculate the improper payment rates and amounts, and they maintain the live data dashboard that shows what's going on with those rates from month to month in the reviews. Now I'm going to provide an overview of the CERT process itself. It begins with the claim selection. Next, the CERT review contractor is going to request records, and once received, they are going to be reviewed. If the review contractor determines an improper payment, remember this can be an overpayment or an underpayment, an improper payment category is assigned to the error. And finally, the last step in the process is that the improper payment rate is calculated. Now, the CERT review contractor sometimes will issue an additional documentation request to obtain additional records after that initial request. But when the initial request is set to obtain those medical records, it's going to ask the provider to send those records for each claim line that's sampled for that CERT review. So in the letter itself, the CERT contractor is going to provide all of the information listed here on the slide. They will send that additional documentation request to the correspondence address that is in the provider enrollment chain and ownership system files or PACOS files. So in those enrollment files, when a provider successfully enrolls with a Medicare provider, there's various addresses that are used for that provider. The CERT additional documentation request letters are sent to the correspondence address. Now, that letter is going to contain a lot of good information. It's going to have details on the CERT process, very similar to what I just talked about with you. It provides health insurance portability and accountability or HIPAA compliance details, some information about the release of those records and releasing protected health information, PHI, PII, and so on and so forth. It'll also list the documentation that you need to send, and it's going to tell you where and the ways or the methods that you can submit it. They'll also provide for you a time frame for responding. They will provide claim information, and very important is an original barcoded cover sheet that you're asked to return along with that documentation. Now, I mentioned earlier that the CERT review contractor maintains a CERT provider website. Specifically, it's called C3 Hub. On that website, you can view the initial and subsequent letter request schedule. I mentioned to you that there's time frames for sending in documentation to the CERT review contractor, and recently, the CERT review contractor initial letter request schedule changed. Beginning with review year 2026, providers will only have 60 days to respond to these requests. And if no records have been submitted, the claim will be denied for non-response. Now, responding within 45 days, if not before, is always the best practice to ensure timeliness. Claim submission dates for review year 2026 are July 1 of 2024 through June 30 of 2025. We're always looking into the past when we're talking about CERT report years. So the CERT report year 2026 includes claim submissions that were July 1 of 2024 through June 30 of 2025. Now, the letters and contact information page on the website also includes information on how to submit those address updates, including how you can request that subsequent additional documentation requests or ADRs be sent to an alternate address. So for more details, you can refer to the letters and contact information webpage on the C3 Hub website. I'm going to open that up so that you can look at it. I know I have the graphic that's included in your handout materials, but I want to show you the actual website closer up so you get a good look at it. And it's not wanting to open the link right now. I do know, folks, if you're attending any other WPS webinars where we're trying to use CMS's website, currently they are doing some updates to their website. They're bringing a lot of their PDF publications over onto web pages. So some of the handouts that you now look at in a PDF format, a booklet format, will actually be moving to web-based education. You'll see it on web pages. So I'm just going to search C3 Hub on the CMS website. You could also search it in Google to get to that C3 Hub website. Here's some provider information about the CERT program that pops up when I looked at or searched C3 Hub. And down here at the bottom of the page in the related link is actually a link to the CERT C3 Hub. That's that provider website maintained by the CERT contractor on behalf of CMS or for CMS. I mentioned to you that there was letters and contact information. You'll see over here on the left side of your screen the menu of items that are part of the CERT C3 Hub website. There's a little bit of information here in the center of the page that describes most of these menu items. But the one I was just talking about was the letters and the contact information, specifically those schedules sent for an initial request if they need to make a subsequent request for additional documentation. Sometimes that medical review specialist is going to identify the need for more additional documentation. So they'll send you another or a subsequent request for documentation. And you'll see that that schedule is down here at the bottom of this page. And it is definitely unlike the schedule at the top. I mentioned to you the fact that for report year 2026, the CERT contractor has changed the schedule for that initial letter, and that is what you can find right here. So claims with universe date on or after July 1 of 2024, which is report year 2026 and later, will follow this schedule as opposed to the schedule that was for report year 2025 and earlier. Currently, we are awaiting the publication of the report year 2025 results. Down at the bottom of this page is how to submit those address updates, making certain, of course, that your PACOS records are up to date and that that correspondence address is correct. If you receive a request for documentation from the CERT contractor, there is a process that you can contact the CERT. There is a process, let me back up. There's a process in place that you can follow so that subsequent ADR letters for that same review can be provided to a specific alternate address. So there's information there about that. And there's also information about the chain address program, which is for those providers who have at least 10 provider transaction access numbers or OSCAR numbers, and you'd like to elect a single point of contact who can participate in that chain address program. There's a bit more information here about group calls. When multiple calls are due to the same provider number, the CERT review contractor is going to group all of those calls so that one single contact can be made to the provider associated with all of those outstanding requests. So great information here on their website about letters and contact information. We'll be popping back out to this website in just a little bit. But right now, back to the PowerPoint. I'm going to pause for just a moment. All right, thanks for hanging in there with me. I want to talk a little bit about sending documentation to the CERT review contractor. This slide that you're looking at now does provide some details that are specific to sending that documentation to the CERT review contractor. You can use any of the methods that are listed on the left side of the slide. You can send it postal mail, fax. You can use submission that's called electronic submission of medical documentation. We call that SMED for short. And to find more details about that process, I've included or embedded a link in your handout where you can find SMED webpage information on CMS's website. If you choose to explore the opportunity to return your documentation using that electronic submission, you can also send documentation to the CERT review contractor by CD or by email attachment. You can find these submission methods on that CERT C3 Hub website. If you are on their homepage, and I just showed you that, you can choose Submit Records to CERT from the left side menu. I'll pull that back over here real quick for you, tell you what I'm talking about, where you can find these methods. Right here, Submit Records to CERT. This is how you can find those submission methods or the details to send by fax or postal mail, or get information about SMED or how to submit using SMED, and email and CD, of course. A lot of information there on that website for you. When the CERT contractor assigns an error or finds an error on a claim, excuse me just a moment, the CERT contractor is going to assign an error category, and they must do so because CMS instructions say they have to do this. So there are 5 major error categories, and I've listed them here on this slide for you. If you open this embedded link, and I'm going to try to do that right now while I'm talking about these 5 major categories, there is a little bit of time being taken to open those CMS websites. As I mentioned, CMS is working on updates to their website. So I have found the last couple of days, actually, that it's rather slow. Might just take quite a while here. When you open this link on the CMS website, it is a CMS document that just talks a little bit in more detail about each of these 5 major error categories that I've listed on their slide. There is no documentation. This error is assigned when no documentation is returned to the CERT review contractor on a timely basis. Remember that schedule that I talked about. They send more than one request. They'll send, they wait so many days, they'll send a second request. So you really do have ample opportunity to get those records into the CERT contractor, and remember, submitting them by 45 days is actually the best practice. For whatever reason, I apologize, that link is not wanting to open today. Maybe it will in a minute when we get past this slide. Another major error category is insufficient documentation. And that is when the CERT review contractor receives those records from a provider, but something's missing. It's insufficient, okay? Perhaps there was missing orders for lab services. Maybe there was documentation returned that shows that lab services were rendered, but maybe the orders were missing. Another type of or major error category is medical necessity. Any time you would submit a claim and have it denied as medical necessity would be one of those situations that the CERT review contractor would also find for medical necessity or failure to meet medical necessity. If you were paid for something and then they did the review and found that the services weren't documented appropriately to show or justify medical necessity, that would be the type of error category assigned. So medical necessity. And remember that policies equal edits and policies define medical necessity. So if policies define medical necessity, that means that there are edits in the claims processing system to catch these claims that aren't meeting the medical necessity requirements. But in some cases, when the documentation is later reviewed, they're showing that the medical necessity was not justified in the record. So they might find an error and assign this category. Incorrect coding is the next of the 5 major error categories. And incorrect coding typically means that there was either upcoding or downcoding of the service based on the review of those medical records. So most often, for Part B services, this incorrect coding really relates to evaluation and management, or E&M services. And that really kind of makes sense when you think about it, because 40% of all Part B claim services, or all Part B claims, I should say, include an E&M service on that claim. Okay, so 40% of the claims we receive have at least an E&M code on them. I'm going to try to get back out here to the CMS website. I'm using my other monitor here and trying to find that document. See if I can find it for you, just so that I can show it. The link is not wanting to open. I know that it's a valid link because it's been tested. But here we go. I found it, actually, I'll show you the steps I took to find it because I couldn't get the link to open. Again, just that delay, I think, because they're working on the website. I went out to the CMS website. If you go to CMS's website, which is cms.gov, you can see it up here in this part of the URL, cms.gov, www.cms.gov. Go to CMS, let me back up here, choose CERT, and search CERT. I'm a searcher, not a navigator. I like to search and find what I'm looking for, boom, boom. I don't like to click, click, click with my mouse, but that's my personal preference. So we're going to look at CERT, not CERT Reports, but CERT, Comprehensive Error Rate Testing. This is CMS's CERT webpage. It talks about the CERT review contractor, gives you the name and address here, talks about if you have questions on documentation requests, this is how you can contact that CERT contractor. But scroll down to the bottom of the page. Well, let me go back up for a minute and just tell you that there's information about the current improper payment rate, always provided for the fiscal year 2024. There was an estimate that 7.66 of claims were improperly paid, representing $31.70 billion in improper payments. Here in the download is a link to that document that I was trying to open, the CERT assignment of error categories. And this just talks about, provides a little bit more detail of each of those 5 improper payment categories of errors, 5 major categories of errors that I talked about. What does no documentation mean as opposed to insufficient documentation? When are claims placed into the medical necessity category? Incorrect coding. This means that based on the medical records, the provider or supplier submitted medical documentation that supports a different code than it was billed, or that the service was performed by someone other than the billing provider or supplier. That happens a lot. Or that the billed service was unbundled, or the beneficiary was discharged to a site other than the one coded on the claim. So a lot of incorrect coding. And then, of course, other is that 5th major category, where things that don't fit into the other major categories, such as duplicate payments, non-covered services, or unallowed services, would be assigned that error. So that's your document, your assignment of error categories document, and this link is embedded. All right, the CERT review contractor shares notification of the errors they assess in a secure website, and they request that the MAC take corrective action whenever they do find an error or they assign an error. What this means is they ask us, your MAC, to make any additional payments or to recover an overpayment. And when that happens, of course, the MAC is going to make adjustments to that original claim. But once the error is assessed, the CERT contractor communicates or notifies the MAC that they've assessed an error, and then we have to step in and take action. We don't do the review of the records, but we have to take action based on their findings. So when we receive an error notice from the CERT contractor, we are going to review the same documentation to determine if we agree with that error that they assessed, or if more records may be needed in order to reverse the error. Now, if we believe that documentation is missing, we have staff in our medical review department who will contact the provider to obtain any missing records. So if we receive the records that are needed to reverse an error, we're going to forward those records to the CERT contractor, and we're going to ask them to review the additional documentation and reverse that error. Okay, so every single time the CERT contractor assesses an error for a WPS provider's claim, we start looking into it. We look to see if we agree with that decision by the CERT contractor. Now, when providers disagree with a CERT decision, they do have the right to appeal the error by following the Medicare redetermination process. Now, it's important that you understand the reason for that CERT error prior to filing your appeal. For example, was your error due to missing documentation? If that's the case, then that missing documentation should be submitted with your appeal request. Now, was your error due to a missing signature? What you're going to need to do is submit a valid attestation with your appeal request or an electronic signature that was appended at the time of the service. Were you missing documentation of medical necessity? When filing your appeal, it's going to be imperative to submit the office note documenting the medical necessity or the reason that the service was requested. Now, this helps you to make certain you include the missing or needed records to support that billed service when you're requesting an appeal. So as long as timely filing occurs, all other levels of appeal, there are 5 in total, are available when appealing a CERT decision. So what this means is if you appeal a CERT decision, send that redetermination request to your MAC, not to the CERT contractor. If you do not agree with the decision by the MAC, if it's not favorable or fully favorable, you do have the right to the next level of appeal, which would be the reconsideration. And of course, you would have to follow all those time frames for each of those 5 levels. Next, I want to talk about tools and resources. Some of them I showed you already. I talked about this one and showed you the CERT provider website, which is the C3 Hub. I mentioned this earlier. I showed it to you. There's a completion status chart, claim status search, all of the things you see here listed, samples of those request letters, document request listings, and I'm going to show you those in just a minute. Frequently asked questions, ways to contact the CERT contractor, and even more. Let's take a look once again at that C3 Hub. Open it up and pull it over here. Show you some of the things out there that I think are really a great help to you. Claim status search. This will help you check the status of a CERT review. When you receive a request for documentation because one of your claims is selected for CERT review, there is a 7-digit claim identifier that appears on a barcoded sheet that you actually use when returning your records to the CERT contractor. If you enter that claim identifier, the CID they call it, here into this box, you can review the status of your CERT review. You know, has it started? Has it finished? Is there an error? Is there not an error? Obviously, when there is an error assessed, you're going to get a letter from WPS because we're going to be either paying you additional money or requesting an overpayment from you because the CERT contractor deems there was an error. However, the CERT contractor, when they find no error, they do not notify you. So you might be wondering, gee, has that review been done? What did they find? Because they don't send you notification if everything's A-okay. Here is some information pertaining to attestation letters in those situations where there is provider's allegation of record destruction. Now, this could be a natural disaster, of course. There's additional details down here. There's information about when you can't use a signature attestation. There are certain times when you can use an attestation statement for a missing signatures, but there's also times when you can't, like missing lab orders. You can't use a signature attestation statement, but for other things you can. Those document request listings that I mentioned to you are very helpful. Now, the letter that you receive from the CERT contractor is going to tell you what they want you to send, but they've also put together these document request listings out on this CERT C3 Hub website. They have document request listings that pertain to durable medical equipment, or DME. What is it you need to submit to them when they ask you for documentation? Obviously, this wants me to download, or Part A has links to various document request lists. Let's take a look at one of these. Let's look at ESRD facilities, just as an example. The PDF document, I'm going to save it and then open it. So here then is the document list. This is what they want you to send if it is for that type of service that you're being asked to submit documentation. Document description over here on the left. So all of this information on the left we've included, or they also include their document description in Spanish in each of these lists. So this is what you need to send. Back to the documentation request listing, Part B. Ambulatory surgical center, anesthesia, chiropractor, diagnostic and lab services, pain management, psychiatric services, therapy services for each of these, and then all other professional services that are billed to Part B. The CERT contractor maintains a document request listing out on their website. So helpful information. There's some information here about psychotherapy notes. There are special instructions that CMS has provided about when you provide documentation for psychotherapy claims. There's their holiday calendar. Of course, there's FAQs, helpful links, and ways to contact them. So a lot of great information out here. Completion status chart. These are just charts that show you where the CERT contractor is in terms of their completion status for the active report period. So report year 2026, you can see here's the total number of claims, and then here is the number of completed claims. So this just shows you where they're at in their review. Okay, how many claims? Remember, I told you the CERT contractor used to review 50,000 claims a year, but just recently the amount dropped to 37,000 claims, 37,550. Will that change? I don't know, but CMS may make a change later where this amount is less. So there would be a law that would change the number of claims that need to be reviewed in this program. So a lot of great information out there on that C3 Hub website. All right, I showed you that claim status search out here on the C3 Hub. Right here, say claim status search. This is where you enter your 7-digit number. And I can't do that right now because I can't show you any PHI or PII. The information out here is not in a secure website, so you won't receive PHI or PII, but I can't use a 7-digit claim identifier. That's a real one for demonstration purposes, but I can talk about it. I mentioned to you that they have the claim status search out on C3 Hub. I do want to let you know that there is a CERT claim lookup tool on the WPS website. I'm going to show it to you real quickly here. Pulling it over. All right. So I'm a searcher. I'm going to look for search. When I key CERT, you'll see the very first result that displays for me is CERT claim lookup, and that's the tool I'm talking about now. This is a tool that allows our providers to obtain results of their CERT review. You can look for this information out on C3 Hub, but WPS provides you with more information. Once again, you need to enter that CERT CID number, hit search, and results are going to come back to you. There is different status of your CERT claim lookup. It might tell you there's no error. That means your claim review is done. No error was assessed. That was great. There might indicate that there is a review completed and an error was assessed, but what we provide for you is the comments that we received from the CERT contractor explaining why they assessed the error. So that's more information, more details, better information, and it also alerts you to what you might need to send us to say, hey, I have that documentation. It's right here, so that we can reverse an error. And then, of course, there's another definition that says that that claim review is not yet complete. No additional information available at this time. That means that that claim review is still in process. Okay, so that is the CERT claim lookup tool. I've linked to it. This should look familiar over here on the right side because that is a cut and paste that I just took from this page on our website and threw it over here onto this PowerPoint slide. So I really would recommend using the CERT claim lookup tool on the WPS site rather than using that CERT status search on the C3 Hub. It just gives you more information, more details. And this just describes those status definitions that I just talked about. It's going to look real familiar, these three, because most of that information I got right here off of our webpage. So a lot of good information there. We have CERT guides and resources out on our website available. I'm going to go to it again here. Oh, here's our website. Now, you've seen me searching up here, CERT, because I am a searcher, not a navigator. But you can also go through the topic centers, go to medical review to find CERT information. Just click it here again, backtrack. Here's that CERT information. And you actually find it under CERT guides and resources. So we have that available to you. Let's see. I'm just checking to see if there was any information about CERT out on our claims page, but it's not. It's all under the Medical Review Topic Center, kind of its own category, really, because we actually have CERT guides and resources. I've provided links to some of those most helpful documents that I think you will find helpful. This is an overview today, so we're not going deep into each of these topics. But let me tell you what, if you think any of this information would be helpful to you for us to spend, you know, we don't necessarily need a 60-minute webinar, but maybe a 30-minute webinar to talk about documenting time in medical records. Or talk about diagnostic services documentation requirements. We can easily plan that for the future based on your feedback. And a way you can let us know about that is complete that survey following today's event and let us know what you'd like to hear about. What do you want to learn about? What are the topics that we can offer you in future webinars? I'm going to try this link to our website to see if I can open the quarterly CERT error report. I don't know, some serious lag time going on here today, folks. So I'm going to go back out to do it the old-fashioned way. And I guarantee you those links work. There's just some technical issues going on now, perhaps with WebEx not allowing the opening of those links, because they certainly are opening when I go to the website. The one I wanted to show you is quarterly CERT findings. Right here, I just typed the word quarterly. Quarterly CERT errors findings report. This is the last time we published these were findings for second quarter of 2025. So my guess is that the third quarter information is going to be going up there shortly. But this can be really helpful. This is the specific contractor error findings that we share with our advisory committees or share with our provider community, our contractor advisory committee, just so we can alert providers of the types of errors that are being assessed for our clients. So I'm going to choose J8B error report. Now this is Indiana and Michigan. Remember those 5 major categories of errors? Here's one. The top error being found for our claims is being categorized as insufficient documentation. 50% of the total errors assessed April through June, for April 1, 2025 through June 30, 2025 for jurisdiction B, J8 MAC providers, that's Indiana, Michigan, are because of insufficient documentation. This has been holding steady for the last few years. This is our largest category of errors. What does that mean? That means that something was missing from that documentation that you sent to the CERT contractor. But remember that every time there's an error assessed, WPS looks at that very same documentation that the CERT contractor looked at. If we think there's something we can get our hands on from you to To negate that error or to reverse that error, we're going to reach out to the provider and ask. So if there is an insufficient documentation error assessed, that means we tried to get whatever was missing and we couldn't get it either, okay? So this is that explanation of why an error was assessed. You'll notice a lot of citations in here. Why? Or where does it say that? We hear that a lot from providers. Where does it say that I can't do that? Or where does it say that that has to be there in my documentation? So you'll notice that there's a lot of reference here to a lot of resources. So that is insufficient documentation. Here's one. Per CERT medical review, missing the referring provider's certification of the physical therapy plan of care relevant to the data service, okay? Now remember, when you're submitting claim documentation to anyone, not just the CERT contractor, but let's say your physical therapy services in June. If the plan of care was set back in April, you need to send that April plan of care along with the documentation for the June data service in order to support medical necessity, or to support that this service was indeed the result of a referral or an order by a qualified or eligible Medicare provider. So remember that sometimes you need to go back. You need to go digging back in records in order to send something along with your current documentation for that data service under review, or your data, the documentation, not current documentation, because it might support it. Same thing with incident 2 stuff. Incident 2 documentation, I should say. Stuff is one of those words I use way too often. If you are submitting documentation to show that you met criteria for payment for a June incident 2 service, that means you better send along that plan of care that the billing provider established back in January, because it shows that the June service is being done based on that January plan of care. Okay, so think about that and remember that if you were asked for documentation from the CERT contractor. Here is some examples of incorrect coding. Remember I mentioned to you E&M. Well, look at there. Here's E&M, E&M, E&M. Okay, down coding, up coding. So here's a down code. Supports down code. But you know, there are those situations where things should have been upcoded. Also, the documentation showed that you should have billed a higher level of care, so we owe you money. No documentation. 16% of the total errors is because we didn't get the information we asked for. Okay. Not medically necessary, only 2% of errors. So I just wanted to show you this is available. A lot of the resources that we talk about up here in these examples of our CERT findings are at the end of the document, so you can quickly link to that information you need. Where does it say that I have to do this or have to do that? Okay. All right. I mentioned to you that a CERT review is appealable. This is a very handy chart that I like to use. It's actually a CMS publication. I'm going to open it. Oh, if I can get to it from here. Let me see if this link works. Not really sure. I apologize. It's much quicker to find them. Bear with me just a moment. Sometimes it's hard to type and talk at the same time. And why is it when you type, when somebody's watching, you always type the wrong thing, right? All right. Here's what I think I'll show you here. Flowchart. Yeah, we're right here. There it is. All right. Bringing it over to show you up close. This is a great resource. I like to show when I talk about appeals. It gives you the 5 levels of appeal. There's the first, there's the second, there's the third, fourth, and then the fifth. It tells you the time frame you have to file your request, 120 days. You have 120 days to file a level 1 appeal done by the MAC called a redetermination. The MAC has 60 days to send you notice of their decision. If not fully favorable or favorable, you have 180 days to file the second level of appeal, which is done by the qualified independent contractor. It's called the reconsideration. They have 60 days to send you notice of their findings or their decision. Level 3 and Level 5 are a little different. They have this here, AIC. AIC stands for Amount in Controversy. It's a dollar threshold you need to meet in order to request that level of appeal, okay? Notice there's an AIC of $190 for Level 3. In federal district court, the amount in controversy, that minimum dollar threshold, is greater than or equal to $1,900. And you'll notice that this is the only level of appeal where there is not a time frame for them to render their decision and send you notice. That really is because in federal district courts, there's not a lot of control over when that case may or may not be placed on their calendar. So there is no time limit for them to make their decision. That's the fifth and final decision. Make sure you're looking at the latest and the greatest. This chart reflects the amounts for 2025. 2026 is just around the corner, so CMS will need to update this appeals process flowchart. There's the standard process for A and B, expedited process that I don't talk about much because I don't provide a lot of Part A education, and this applies only to some Part A only appeals. So that is appeals. All right, CERT webpage, CMS's CERT webpage, I actually showed you that. On the CERT webpage, I do want to show one thing. Webpage, here we go. CMS, getting it ready for you folks. CERT. All right, I want to show you on the CERT webpage. You can go to the CERT webpage right here, and then choose reports in the menu, or you can link directly to it with the documents that I gave you. These are those CERT reports year by 4 that tell you the results of that CERT report period I told you. Notice the 2025 report year is not out there yet, but I want to pick out this 2024 CERT report and show you the great information in here. Has top root causes for lab tests, top root causes for office visits, for glucose monitor, for surgical dressing. It has state-by-state information. And another thing that's really helpful when you're looking at all of this great information is you can look at Part B errors, service types with the highest improper payment error. Look at that. It tells you the projected improper payments, the improper payment rate, what kind of errors were being assessed for each of these kind of items over here on the left. Sorry, that's all. So great information. Take some of this information, pull 5 charts in your office when you look at some of the findings and results elsewhere in this report, and see if you're documenting those services correctly. This is just a great tool to make certain your claims are compliant. Information by state, look at here, improper payments by state. Missouri, the improper payment rate is 1.5%. California, it's 9%. Look here, Arizona, 21%. So some great information out here if you have time to look at it. I know all of that takes time and you are all very busy. We do have a CERT ABMAC Outreach and Education Task Force. It's led by CERT staff, it's led by CMS staff, where all of the MACs meet monthly with CMS to come up with national education products aimed at reducing the CERT improper payment rates. So on this webpage, I am a member of this task force actually. It includes links to their resources, web-based training, presentations, CERT videos, so on and so forth, and anything that is published as a result of the efforts of this task force has this logo on it over here on the right. This is the CERT ABMAC Outreach and Education Task Force logo. CERT reporting, I got ahead of myself earlier and I showed you the CERT report. This gives you the improper payment rate, the dollars associated with that improper payment rate, and this is what breaks down those errors for you, and even by state, by service type, and so on and so forth. So a lot of great information there. Highest level summary of findings. I showed you some of these already, so I did get ahead of myself. Here are the common causes of improper rates based on that report. I pulled this from the report. And all our claims at WPS, remember those error categories? The largest number of errors assessed for WPS was insufficient documentation. This is the common causes nationally. 59% of the CERT errors assessed in the 2024 report year were for insufficient documentation. Our next one, I believe, was no documentation, where that one's moved a little further down here nationally, but medical necessity is at 15%. This is time for questions, and we are getting short on time. I'll open for a couple. Bailey, are there any questions that relate to what I talked about today?
There have not been any questions in the chat, Mary.
Well, that works out well today because we are running out of time, and I want to keep you on your schedule. Tell you what, though, for a period of 7 days following today's event, you can certainly submit any questions that you have pertaining to what I talked about today. We're going to also ask you to complete that brief survey. Let us know what you think about this customer experience. The survey link is in the chat. Bailey's placed it there. There's also going to be, when you leave the webinar, a redirect. You're going to have a window pop up. It's going to look like what you see on the top right side of this page. It is not malicious. It's just giving you one last opportunity to click on that blue button and open the survey and take it. Now, if you've already taken the survey, you can certainly X out of it, but we'd really appreciate your feedback. Let us know what we can do better. Let us know topics you want to hear about in the future. This is just a slide that I've included in my presentation, something we're trying to get the word about, the annual Medicare participation announcement. So if you are still trying to decide if you are going to be a participating provider in Medicare for 2026, there's information that we encourage you to read. There is a link here, and this has been all over our website lately. Just yesterday, we sent out a special e-news blast about the annual Medicare participation period. Once again, I want to thank you for attending. Remind you that you can send follow-up questions for a period of 7 days. You'll need to send them to our education mailbox, and Bailey's going to put the email address in the chat, but this is also included in the notes section of the PowerPoint that you had access to and could have downloaded. Send it to wps.gha.education@wpsic.com, but make certain in that subject line you put CERT. That way the staff member that's monitoring our education mailbox will know to get that email to me so that I can pull together all those questions and answer them and get an email out to all of you with any follow-up questions and answers. Thanks for attending. We encourage you to provide that feedback in that survey. We want to know what you liked, what we can improve on. Also include any other topics related or unrelated to CERT that you would like us to include in future education. We are planning another Medicare Education Expo. We're going to announce details next week for that event. The event is on January 27th. It's going to be a full-day event, but you can pick and choose the breakout sessions that you want to attend. And this one is warm up with WPS departments, and we've really designed this to talk about each of many or several departments here at WPS, what their tasks and responsibilities are, and what kind of advice. We're going to each of those departments and saying, do you have any issues or that we can bring to the provider's attention to help them in the future and to help reduce the number of appeals, for example, or appeals that we have to dismiss, those kind of things. I'm going to be doing a presentation on POE to learn a little bit more why we do what we do. Why don't we answer questions, general inquiries and telephone inquiries? Why do we send you to customer service for that? How do you get CEUs for our events, and so on and so forth? So you can learn about that. We'll be sending that out shortly. At this time, on behalf of Provider Outreach and Education, I do want to thank you for participating. We look forward to those survey comments, and we hope to have you join us at future events. You may now disconnect from this webinar. Have a great day, everyone.